So hi, my name is Kyle Lennon, and I'm an attending physician in emergency medicine, and I work for Northwell GoHealth Urgent Care. Today I'm going to be talking about arthritis. So arthritis is inflammation of one or more joints, and it has many different causes. Today I'm going to cover the most common causes of arthritis. So the most common cause is called osteoarthritis, which is the degeneration of joint cartilage. So normally, in a normal healthy joint, the joint surfaces are lined with a smooth, shiny cartilage called articular cartilage, and that functions to decrease friction as you move a joint. In osteoarthritis, the normal articular cartilage softens and starts to break down, which leads to increased friction, rubbing, and then the symptoms of arthritis, pain and inflammation. So the symptoms are people with osteoarthritis have pain, they have stiffness, on and off their joints can swell. This usually does get better with rest and worse with increase in activity. And as the osteoarthritis worsens, it can progress to loss of range of motion and loss of function. So the risk factors to developing osteoarthritis are age. So as we age, the normal articular cartilage does wear out over time through wear and tear. So arthritis usually affects older people. Also, prior joint injury. If you have a significant injury to that joint, such as a fracture involving the joint surface, or take for the knee, for example, if you have a significant ligament injury, such as an ACL tear, those types of injuries can predispose you to getting arthritis, and that joint will wear out a little bit sooner than if you hadn't injured that particular joint. So you might get earlier arthritis, osteoarthritis. Obesity is also a risk factor to developing osteoarthritis. So the more weight translates to more stress on that particular joint, and those joints will wear out faster. This is particularly true of the weight-bearing joints such as the knees and the hips. And there's also a genetic component to developing osteoarthritis. So osteoarthritis can really affect any joint. Commonly it does affect, like I talked about, the knees and the hips. And as the osteoarthritis advances, simple activities such as walking, when it involves the weight-bearing joints, can be difficult. But arthritis can also affect the joints in your hands, in your wrists, and even your spine. So as healthcare providers, we make the diagnosis by listening to your symptoms. On X-ray, you can see signs that you're developing osteoarthritis when the joint space becomes narrow. As the cartilage wears out, the space between the joints narrows, and the bones can start rubbing on each other. And in severe osteoarthritis, you can see bone-on-bone arthritis. You can also see bone spurs or hardening of the bone on X-ray. But in early arthritis, early breakdown and early softening of the articular cartilage, an MRI might be helpful. The treatment for osteoarthritis is, if you have a painful arthritic joint, is to rest it. Ice can be helpful. Over-the-counter anti-inflammatory drugs such as ibuprofen can help alleviate some of the pain and swelling. Over-the-counter pain relievers such as acetaminophen can also be helpful. You will want to modify your activities to try and avoid painful activities and activities that worsen the symptoms of your osteoarthritis. Physical therapy can help if you strengthen the muscles around a particular joint. That can take some pressure off that joint and make you feel better. And weight loss. So weight loss is very effective. It's hard to do, but if you do lose weight, that's going to lead to decreased stress in that particular joint and make you feel a lot better. And also your arthritis might not advance as quickly if you are able to lose some weight. When those interventions and treatments aren't working, injections can be helpful. Corticosteroid injections, also known as cortisone shots, can be introduced right into a particular joint to decrease pain, swelling, and inflammation. Also, there are hyaluronic acid injections, which are commonly referred to as lubricating or gel shots. These are mostly used in the knee for knee osteoarthritis, and that can also help with pain and inflammation in the knee. This is typically a series of injections, weekly injections that can help. And when that's not working, when rest, ice, anti-inflammatory drugs, injections aren't working, and your arthritis is advanced and it's really interrupting your daily life and negatively affecting your life, and you're unable to do the things you want to do because of arthritis, then you have to start thinking about surgery and joint replacement surgery. So that's all I have to say about osteoarthritis, which is a degenerative arthritis, and now I'm going to move on to talk about inflammatory arthritis. So rheumatoid arthritis is an autoimmune disorder. It's an inflammatory arthritis where the body attacks itself and attacks the lining of the joints. And symptoms of arthritis are pain, swelling, stiffness. In rheumatoid arthritis, usually multiple joints involved on both sides of the body. It's symmetric joints, so both hands, both wrists, both knees can be affected. Oftentimes people will have fatigue, just generally not feeling well, sometimes low-grade fevers. And this, you can diagnose rheumatoid arthritis through x-rays and blood work. Right? The treatment for rheumatoid arthritis is anti-inflammatories again, like ibuprofen, or sometimes prescription anti-inflammatories can be helpful. Prednisone is also an anti-inflammatory that can help symptoms. And then there's a number of stronger medications that basically change the way your immune system works, so your body stops attacking its own joints. These do have serious side effects, but are often necessary in the treatment of rheumatoid arthritis. So if you have rheumatoid arthritis, most people who seek treatment will be best served by seeing a rheumatologist. So gout is another type of inflammatory arthritis. So this is caused by uric acid crystals that deposit into particular joints. And those uric acid crystals create tremendous inflammation. So symptoms of gout are severe pain, swelling, the affected joints become very red, warm, and the pain is usually very significant, often interrupting sleep. Usually, the most common joint that gout affects is the first toe. So the base of the first toe, called the first metatarsal phalangeal joint, is the most common joint affected. But it can affect other joints, and sometimes multiple joints. Sometimes gout attacks can last for days, but sometimes patients can have symptoms for a number of weeks. Triggers for gout include various foods and drinks that are broken down and can increase your uric acid level. So red meats, certain seafoods and shellfish, and alcohol can increase your chances of getting a gout attack. Also, some medications can increase your chances of getting gout, such as hydrochlorothiazide, which is a common medication used for blood pressure. It's a diuretic or a water pill, but that can sometimes increase your uric acid level. In order to make the diagnosis of gout, sometimes it's a clinical diagnosis. So if somebody comes to see me and they did not injure their toe and they have a very swollen, tender, warm first toe, and they're very tender at the base of their first toe over the metatarsal phalangeal joint, most of the time that's gout, and no other diagnostic tools are needed. You just get treated. If the diagnosis is questionable, the way to definitely diagnose gout is to stick a needle into that particular joint, aspirate the joint fluid, and send the fluid to the lab. The lab can analyze it and see if there's uric acid crystals or gout crystals in the joint, and that confirms the test. Blood work, you can also send blood work, a lab test for uric acid, but in acute gout flare, your uric acid level might be normal or it could be high, so it's not helpful. The definitive diagnosis for gout, like I said, is joint aspiration and analysis of the joint fluid. Blood work can be helpful in the long-term treatment and management of gout. So the treatment, first line, is just anti-inflammatory, such as ibuprofen. There's also a prescription anti-inflammatory called colchicine that can be helpful to decrease pain and inflammation. If a patient cannot tolerate anti-inflammatory drugs such as ibuprofen, because their kidneys might not work well. Prednisone, a course of prednisone can be helpful. And then if you have recurrent episodes of gout, there are medications that you can take daily to decrease recurrent episodes. And the last type of arthritis I'm going to talk about is called septic arthritis, and this is probably the most dangerous type of arthritis. It's an actual infection in the joint. So this can happen either from a local infection or an infection in another part of your body that spreads to a joint. It's also a very rare but serious complication of surgery. So in patients that have septic arthritis, the joint is very painful, it's swollen, it's usually warm to touch. Most of the time people will have fever and tremendous pain when they move their joint. To diagnose septic arthritis, you usually use blood work and joint aspiration to analyze the fluid to see if there's any bacteria in the fluid. If a patient has septic arthritis, the treatment usually involves going to the operating room to wash out that particular infection, and also a prolonged course of IV antibiotics is usually necessary. So hopefully that was informative, and if you have a painful joint that's bothering you, I feel that GoHealth is a great place to be seen. There's no appointment necessary. We have on-site x-ray. We have the ability to send off blood work and blood test if we feel that that's necessary, and we can evaluate and treat your joint pain. And if you need a specialist, we can recommend a specialist within the Northwell network if necessary. So check us out. We have many locations now at GoHealthUC.com. Thanks for your time.